Today I focused on an update about what we know about the molecular changes in the myeloproliferative neoplasms and how they have already and will continue to change the way we classify these diseases, the way we diagnose these diseases, and the way we give patients prognostic information. It's fair to say that the discovery of mutations like the JAK2 mutation, the CALR mutation, for example, have already revolutionized how we diagnose these patients. So a JAK2 mutation test is now, surprisingly, the commonest, most requested molecular test in any cancer at this stage. And the reason for that is because it's really helpful when it comes to making the diagnosis to distinguish a myeloproliferative neoplasm from a number of other causes of high red cells, high platelets. So diagnostically, these mutations have proved really useful, really important. Going forward, I guess the main message from the talk today, towards the end of the talk, was how can we move to the next step in terms of helping patients understand what the outlook is likely for them as an individual. And so we have been exploring the idea of knowledge bank, a knowledge bank based on a large number of patients, over 2,000, who we have characterized in some considerable detail at the level of the molecular changes that have occurred. But we also know all of the clinical information about these patients, with age, gender, hemoglobin, laboratory results, for example, and also, of course, the outcome. What happened to those patients? Did they develop myelofibrosis? Did they develop a leukemia? And we also know whether they survived or died. So we can put all of that together, the genetic, the genomic, the clinical, the laboratory data together. And by doing that, we can generate a knowledge bank, which allows us to then take a patient in the clinic in front of us. We can now take this patient, enter all their details, as it were, and the computer can then generate a personalized prediction for that patient based on all the information we know about that patient and comparing them to this data knowledge bank of over 2,000 that we have. So I think that's a new way of moving forward. Instead of taking a patient and putting them into a category, a sort of low risk or a high risk, we are able now to be much more precise about what the outcomes are likely to be for a particular patient.